Healthcare assistants are trained and educated to provide all of what they refer to as activity of daily living needs. What that is bathing, feeding, if they need assistance in mobility, dressing, going out shopping, communicating, give them companionship, anything to provide that compassionate care for seniors in their homes or in residential care homes or other areas the practice is needed.
They are basically the main person, the go-to person, and they're the one that's helping all our elders do their care as soon as they wake up in the morning until they go to bed.
Basically, they're the guardian angels with whatever they need throughout the day. The care aides are generally there to assist them with everything they need.
The really key characteristics or qualities is compassion. Compassion, patience, being able to bring joy to someone.
An ideal HCA would definitely need to be positive and patient. They would probably need to be outgoing and assertive, but kind as well in their assertion. Definitely somebody who is able to change in a fast-paced environment because the environment is constantly changing and you need to be prepared to kind of go with the flow and prioritize because things change all the time.
When you get older and older and all at once you can't do this and you can't do that. Sometimes I found it hard to get out of bed and stuff like that, and they would have to help me get out of bed.
There are more and more of us getting older and older and living longer, and with disabilities. I had this stroke, and I said to my daughter, well, I don't want you looking after me. You know, I'm a 24-hour patient, if you like, and I didn't want that happening. This is the best place to be if we have to be like this. Health-wise, they look after me very, very well.
They have 2 dining rooms that are air-conditioned, and that's where we eat usually. They have all these different programs that you can go to, which I did at first. I went to almost every program they had.
We are observing the Eden philosophy. There's 3 plagues in the lives of the elders. The 3 plagues being loneliness, boredom, and helplessness. So the care aides usually would help address those issues by, let's say, loneliness. We're here for the care aides, we actually encourage them that each day you give something extra to the elders, like, you know, praising their hair if they look nice, or, you know, giving them nail makeover if they need to, doing a little extra for them. And our care aides are really good at that. Some of them, I would notice that they would even take their own time at home just to prepare something extra for the elders. And also when you go around the neighborhood, you can see some elders folding towels or watering the plants. We're giving them some of that responsibility. Even those little things, it will give them pride and sense of purpose, just giving them activities that will help them and make them feel that yes, they are needed, they have this responsibility, and that they still have that purpose. To be a care aide is to be humane, because it entails a lot of patience to be in this field. This is a very challenging position to begin with. Most of our elders here, some of them have great cognitive impairment, and to be able to deal with them on a daily basis is already a challenge, because some of them, when you're offering your help or assistance, they would refuse. Not because they don't want the help, but they don't recognize the need for it. And so as a care aide, you will have to persevere in order to give that elder the basic care that she needs. You will have to encourage her. Sometimes you will have to redirect, you know, all the techniques that you know just to get that task done.
It's not only the friendship that they develop, but they become our second family. Our care staff are very, very attached to our elder. And by having that relationship, our elders is more cooperative. They know exactly how the care aide works.
I have nothing but respect for the healthcare assistants, because if it weren't for the healthcare assistants, the nurses don't know the patients or the residents the way that the healthcare assistants do. They are the first line of defense, if you will. They come to you and they know when your patient is having any kind of a bad day or a good day. They know them way better than I do as a nurse. And so I 100% depend on the healthcare assistants to come to me with whatever needs to be done for that patient. What I first noted about Stenberg College right away when I started here was that there are so many resources available to the students, and the faculty and the school itself really cares about the success of Stenberg College students. What particularly impresses me about the HCA program here is the in-depth and breadth of knowledge and curriculum that is taught. It's not only just the provincial curriculum that's being taught, but it goes further so that the healthcare assistants can understand the diagnosis, not just what to do when this person has this. If they fully understand it, then they're going to do better in their career.
Our HCA program, I feel, is one of the best because of the simulations lab, the nursing lab, the way that they have integrated the nursing instructors to be able to have them in the same classroom, sometimes in the same lab as nursing students. So they have that cross-pollination of information with each other.
I get really excited when I teach, and I'm sure some of my students, if asked, would say this about me. I'm not just talking about diabetes, for example. I get involved in the background of it and then how to care for said person with diabetes. And so what I hope to pass on to my students is to get excited about it and not just treat it as just a job. It's not just a job that pays the bills. You're helping people, you understand, you do this, and this is the rationale for it. And to be able to help people, and not only the patients, but their family and their extended family and the colleagues that you work with, I think it's really exciting for me, both on the floor, nursing, and to instill that into my students. What I like my students to take away from the classroom, not only into their clinical, but into their careers, is the ability to believe in themselves and that they really are making a difference.
Growing old is inevitable, I suppose, and from my point of view, I just do the best I can for myself and for other people. I really think that here the staff are wonderful, and I'm just thankful that I'm in a place like this.
Before the HCA program, I was a housewife and I have regular jobs, but not a career.
Coming to Canada, I have like big dreams. For a starting point, it is very hard. I got like little bit confident. Okay, I can work in a gas station, and I started working there. But going and coming back, it's the same routine, and then it's just stuck. The life is stuck.
My life before this, I was a digital designer. It was just hard to deal with contract jobs and not knowing whether if I'm able to support my son next week.
When I first started, all over it was a good experience, but I did have some obstacles. With the extra help from Stenberg staff, I pulled through with success.
We work together. If there is any kind of problem, personal problem, or about the education, so we work together, and so that everybody is fine.
We were given all the tools and all the skills that we needed to have in the real world.
Now, I got more confidence that I can do better.
All the comments I got from my preceptor, they said it did not feel like they're working with a student. It felt like they're working with another HCA.
Aide called me one day, come for an interview. So, and then I got the job.
I have a stable job where I have income coming in, which I love doing. And then with that, I can also invest into my hobbies, which is design now.
I love working with elderly people. I love making a change, giving my minute or two and talk to them, make a difference in their life.
Having this job is perfect for me.
I remember one time I did go back, even though I was already off clock, I went back and went to see one of the residents. And just seeing their faces react to you, even coming back to them to talk to them, it's just rewarding. Not only it feels right, but it just, you're happy, knowing that you're making other people happy. I have a feeling that eventually people are going to realize this is a good, perfect career choice.